Back on Sports Final, lots of medical knowledge necessary if you're tracking the Lakers these days. And with that in mind, we welcome one of Orange County's most respected young orthopedic surgeons, Dr. Christopher Ninh, who does not treat Kobe Bryant or Steve Nash, but who is certainly more than qualified to discuss cases like theirs. Thank you so much for being here.
Thank you, Rebecca, for having me.
We have a lot of questions because, you know, everyone loves the Lakers and everyone's wondering about Kobe. I guess the first is, what is the normal recovery time after an Achilles tear and then surgery, like for any normal person to come back?
Sure. So from my own experience, I had an Achilles tendon rupture also,
Right.
and also with my patients. It takes a good 10 to 12 months to really regain full recovery.
So, okay, Kobe is saying that he's going to be back in action sometime this month. That leaves, it's about fewer than 8 months, you know, since he tore his Achilles. Is that recommended? Is that very impressive? What do you make of that?
Well, Kobe is a phenomenal athlete. I mean, he's a freak of nature.
Yeah.
The thing is, you know, 6 months, most tissue heals, but you really need strengthening and rehabilitation. And that takes a good another 6 months. And 7th, 8th month is pretty remarkable.
Remarkable because, you know, we talk a lot about Kobe Bryant, and he's not normal. I mean, let's just put it out there,
Sure.
right? He is a machine. He recovers very quickly, and we've seen him come back from pretty incredible injuries before and be crazy good on the court, again, just like the normal Kobe. Do you think that he is going to be able to come back and be his old self?
Well, his mind is incredible. He wills his team to win. He wills himself to heal, but we all succumb to age and injury. And so, you know, we're getting older. Kobe is a great athlete. He plays very well. I think he's going to do remarkable things for the Lakers. He's going to be very productive. But the same athleticism, I don't think it's going to be the same before injury.
It's going to be interesting to watch that. It's going to be hard to watch, isn't it? Because a lot of people expect him to come back, and he mentally, you know, expects that he's going to come back as well. All right, so let's talk about Steve Nash, the other Lakers star we're waiting on. 40 years old. He is the oldest player in the NBA, battling nerve damage. It's radiating into his back, hips, hamstring. Is there any hope that the epidurals he has been getting can block enough of that pain so he can play?
Epidural is going to help with his pain. It's too early to tell. It's only been a few, not even a couple weeks yet, and you got to give him some time for patients to heal, for him to get better. Epidural is going to definitely help with the pain. He's going to be out there. Give him some time.
A lot of people I've heard say you're not really supposed to get that many epidurals. It's not really recommended or safe, but is it? I mean, for athletes like this?
Epidurals are not good for you. It does cause damage if you do it repetitively over and over again, but it will take away the pain, take away a lot of the inflammatory process, and again, hopefully it's just a one-time thing.
I know you're a Lakers fan.
Definitely.
And you've been through the same thing with your Achilles.
Yes.
So I know you're hoping Kobe makes the comeback, huh?
You know, Kobe's going to do whatever it takes. He's going to modify, adjust, make his other team players better. You know, work more on the outside, the other parts of the facets of the game. And he's a great player. He'll always be a great player.
Mentally, he will come back in full, I'm sure. He definitely believes that. All right, Dr. Christopher Ninh, thank you so much for being here. And Lakers, by the way, trying to get to 500 tomorrow night, hosting the Sacramento Kings. Will Kobe play? We will find out.
Hi.